Hi everyone. It is Mental Health Awareness Month, and I'm here with Carbon Convos talking with Vikki Walton, who is a health equity expert who works as a senior principal and health equity leader at Mercer in the MercerWELL practice based in the Chicago office. Vikki, thank you so much for joining me for Carbon Convos. We're going to talk about mental health and workplace resources because, as we both know, people of color, particularly Black people, tend to have a lot of challenges in the workspace that are maybe different from other experiences. So first, Vikki, please tell us what you do.
Yes. So thank you for having me. And one, I love talking about, I'm very passionate about health, but particularly health in populations that over years, decades have been experiencing disparities in poor health outcomes. And so I'm very fortunate to work for one of the leading healthcare consulting firms and leading our Center of Excellence around health equity. And so we work with clients to identify ways to bridge the gaps in care for their employees that come from a variety of different populations and experiences. And so, for example, we're very focused on people of color. We're focused on those, from the LGBTQ plus communities, from women's health, life and age and stages. And so we go in and we really find ways to support that employer through benefits and other areas to help address those disparities. And so
So
I have a team of folks that are subject matter experts that do this work.
Awesome. So as we know, mental health challenges in the workplace are typically higher for Black employees. There was a Harvard Business School article that came out last year that states, and I quote, "New research shows that in addition to receiving smaller paychecks, Black workers are also less likely to have supportive bosses, a positive work culture, and healthy work-life balance." So this is clearly a recipe for disaster and anxiety and depression. So other things that can contribute to mental health challenges in the workplace for Black workers include microaggressions, being overlooked, being singled out, being labeled as having an attitude when maybe you're just expressing your opinion as strongly as your white counterpart, being questioned and judged about our hair, having the burden of code switching so that you can fit in and rise up the corporate ladder. All of those things happen. And what are some things that people can do to manage their mental health at work, and what work resources are available or should be available to help Black employees manage their mental health?
Yes, so that's such a great question, and the research is quite a bit around the challenges that face people of color, particularly Black employees. And you gave examples of what happens in the workplace, but then there are also mental health challenges outside of the workplace, right? So you got both situations for people of color, whether we're dealing with some social challenges within our communities, whether we're dealing with our family challenges, and then mental health issues or challenges within the workplace. So we have to find ways to, and employers have to find ways to acknowledge and support all employees, but particularly those from diverse populations. And so what I will say, our research has shown that mental health is a top concern. So Mercer does surveys with leading employers and employees, and it's a top concern across all demographics.
You find that that concern has increased since COVID happened?
Absolutely, absolutely. I was just about to say, since post-COVID, you're seeing a rise, not just with employees themselves, but within their families. So we're starting to see teenagers, younger populations are having challenges, because of schools and all the things that happen post-pandemic. So this is a burden, not just on all employees, but particularly for people of color. And so what we've also found is low wage workers, younger workers, and our Generation Z are coming in and saying, we need you, employer, to do some things differently. And they're much more vocal about mental health than, say, some of the more tenured generations where it was taboo to bring up, some of the mental health challenges within the workplace. And so we're starting to see a shift with employers saying we have to do something different. We have to address this. And most importantly, we have to do things for populations where We understand it's a top concern. So what we found is people of color, Hispanics, African American, it's the number 3 concern as far as mental health, number 5 overall for all populations. Until we have employers saying, we got to do something different, and we're going to do some things differently to support these populations.
And when you talk about this, new, fresh, young generation of millennials coming in and being really vocal about mental health concerns and wanting resources and holding their companies accountable for mental health challenges in the workplace, that brings me to a question of wondering, how do you feel about an employee disclosing their mental health status?
Yeah. So what we see with employees disclosing, there's some sensitivity around it, of course, right? What we find though is that the younger generation, to your question, tend to be a lot more vocal. They'll say we need a mental health day, and they don't have a problem with sharing, anxiety, depression, overwhelmed. They will come forth and share that. But what we want to make sure is that we have managers that are culturally competent in order to address some of those discussions with their employees, and that they don't harbor biases that we've seen in the past, but to foster and encourage and make the necessary accommodations, because it could be physical, it could be mental. So there are a number of different areas in which management needs to be competent in addressing that. But what we also know is that employers have EAP programs, employee assistance programs, which are very confidential. So you can lean into that. It's just a matter of making sure employees know what benefits are available to them and then actually utilize the benefits. And what we have found is that populations of color do not utilize those benefits like they should for a
Yeah.
variety of different reasons.
And because I love EAP. I've had some opportunities to meet with counselors who were EAP counselors, and sometimes you only get maybe 3 to 5 sessions. Sometimes you might get a little bit more depending on the program, but some of those sessions that I've had that were maybe only up to 3 were really, really impactful.
Mhm.
Work with other employees who didn't even know that the resource existed, and I'm
Mhm.
thinking, well. And I'm the kind of person, I look stuff up, I research, I ask questions. As you can, probably tell, I'm very inquisitive.
Mhm.
But I always wonder, why don't most of the employees know that these resources are available, and particularly Black employees who seem to really be in need of those services, or be in need of services that are going to meet their particular needs. Because I know, for instance, after the height of the pandemic, when people are wanting a lot of employees to come back into the office, there are a lot of Black employees who don't want to go because they're noticing that their mental health is better at home because they don't have to deal with the in-person microaggressions, et cetera. And some of these employees are not utilizing the EAP resources because they're not aware. What's a big reason for that?
Yeah, no, that's a great question. And not just people of color are not aware, but just in general, employers have to do a better job of, one, making everyone aware of all of these robust benefits that they have, which is one of the things that we go in and work with clients on, is like, how are you best communicating the resources that you have? Because it's important that they see engagement, because we know if your mental health isn't right, or you have challenges, you cannot be the best employee that you can be. Or if your children or your spouse are having challenges, you cannot be the best employee. And so it's important that they address it. So communicating effectively and making sure the communication is inclusive, and making people feel that there's no biases, and almost normalizing utilizing these services, right? It's not a negative thing, it's a positive thing. We
It's,
also, I'm
it's,
sorry,
it's
go ahead.
it's there for you. There should be no stigma around it. If you
No
need
stigma. Absolutely. These are shit.
financial assistance, those types of things are included in EAP as well. You'd have no problem utilizing that.
Correct. So normalize it, and have some employers have campaigns.
Right.
They'll have mental health, communication campaigns that's targeted specific to population. So we've had clients that'll, Black health, Black mental health, Black awareness, specifically targeting populations to help them understand that it is okay. We also have challenges within our own community, right? We have to get past the well, maybe we should pray it off, or you don't really need to do that, where we have to remove some of the stigmas that we have when it comes to addressing mental health. And I think we're seeing that shift, particularly with the younger population saying we need the help.
I was
One
going
of
to
the
about that. Do you think that in general the Black community does stigmatize getting assistance with mental health, going to a therapist, or do you think it's generational?
I think that it's both. So I think I think it's generational, and old, some of the more tenured populations that are like, I'm not sure about, having a conversation with a therapist. And then you have those that are younger and those who are needing the help, and learning that it's important, as we continue to educate within our communities, that this is the best thing to do. And I will add that I think women of color are leading the charge on that. And they're saying we need to um, take advantage of talking to therapists for ourselves and for our children, and changing that paradigm of stigma where, yes, you can certainly lean in on your religious beliefs, but then you can also get some support,
Yes.
from someone who's trained to help address some of those challenges that you may be facing. Additionally, we work with employers to say if there are any barriers. So you mentioned earlier that you may have been allocated 3 to 5 sessions. That may not be enough. So how can we remove the barriers so that there's no cost to or significant cost, out-of-pocket cost for that employee? Because when you start to have costs, that's whether it's a copay or whatever that cost may be, you're going to see folks that say, I can't afford that. If they're lower wage employees, or if they have just challenges in general financially, they're not going to probably leverage those funds towards that. So let's find ways to remove those cost barriers. And we should start to see more utilizations by people of color.
Because even though it's changing, a lot of therapists do not accept insurance. It is changing, but a lot of therapists don't accept insurance because of the paperwork that is involved and charging everybody and all those kinds of things and dealing with all the different insurance companies. Because a lot of therapists, if they're not working with an organization, they're working for themselves. So they have to do everything themselves. So that's one reason why costs can be so expensive for therapy. Another barrier that I am hearing is that when people of color are considering going to therapy, they want cultural competency and they want to see someone who shares the same identity.
Right.
But at 2% of there's 2%, there's like psychologists and psychiatrists. I think there's 2% of psychologists are Black and 3% of psychiatrists are Black. So, and don't necessarily quote me on that, but the percentage is very, very low.
Correct.
So there aren't a lot of Black therapists for people to see if in fact that's what they want. Psychology Today is a really great resource. They've updated their database. You can search via your insurance, what area, ethnicity, background, location, blah, blah, blah. I actually found my therapist that way. She is a Black woman and it's been great, but not everybody has had that level of success. So cultural competency, I think, poses a challenge as well. And also, in talking about cultural competency, you mentioned that with managers being able to have an effective conversation with their employees regarding mental health. How common would you say training is for people in management to be able to have those types of conversations? Is that something that Mercer offers?
Yeah, that's a great question around the training. So we think it's important. We do talk to our clients about training, and we are working with clients on training for not just mental health, but health in general. How do you best leverage your benefits and be comfortable in having a conversation with your employer? So even if it's mental health, or it could be diabetes, are you comfortable with saying, I have a challenge with diabetes?
Conversation real quick.
Yeah, it's it can be, there has to be trust, obviously, with the employee and the manager, but then the manager again has to have sensitivities and sensitivity training. And so we're seeing organizations saying this is important. I will also add, you brought up providers and clinicians that represents the community that the patients live and reside. That is probably one of the number one concerns that we hear from employees of the different diverse groups is that they cannot find someone that represents the communities that they came from or understands their challenges. And so this is a big focus for a number of different organizations that support mental health for people of color. They are trying to build that pipeline. So that's going to take time because to your point, the percentages are so small. It's hard to find someone of color and then get in a timely fashion. Like how soon can you see them, right? You're talking 6 months out because the demand is so high. And so these organizations, various organizations are coming together to say we have to do better. So they're building the pipeline. But in the interim, you have to train your staff. Because so if I cannot get someone that looks like me or per se, I believe is relatable to me, then whoever I get, they have to understand the cultural differences between populations and support their needs. And so we're seeing that happen and a heightened emphasis across the board on providing that for employees of color.
And that's really good to hear because I also think that a lot of managers need to understand that being a manager or a supervisor, being someone in management, it is not just about managing the work or making sure people get paid on time. It is actually about managing the person, and the person with a lot of nuances and challenges and difficulties that are not that don't stop, between 9 and 5 o'clock. So
Correct.
training, that effective communication, even if you're a manager who doesn't necessarily want to do it, you're like, wow, this is above my pay grade to have this kind of conversation. But it's really, really important, even if you don't necessarily trust your boss on a personal level, at the very least, you should be able to trust your boss's level of professionalism if in fact you have to go to them with something that is relatively personal or challenging.
Absolutely. And I agree completely. Again, the boss may need to make some accommodations or adjustments, such as, maybe adjusting those hours, allowing for some flexible hours or modified duties while they're going through whatever the situation is. Just help them manage the system for their overall well-being, again, so that they can come to work and do their job at the best of their ability. And so it requires a manager to understand that this is important and understand that there's different challenges for different populations. So people of color have an extra layer
Yes.
of challenges within their lives that the broader population may not be experiencing. So recognizing that and having some sensitivity around that and making accommodations where appropriate is critically important. And so training that management team to think that way is important.
And then that is a space where DEI can come in. And, people trying to get rid of DEI, but that is a part of being able to address someone's mental health, particularly if they're having those types of challenges because they're feeling discriminated against at work, or they're experiencing, again, microaggressions or other things that are tied to their racial identity. So it's all interconnected for the Black population. And my experience has been that a lot of companies, and I'm also in St. Louis, so there's a deep, deep, deep history of racism and segregation here that is still present. And it has been a challenge to find a workspace that can really accommodate the particular challenges that go along with being a person of color in the workspace. Whether it's on their radar, whether or not they do get training and that training is effective, because I used to do DEI training. So, you can go into a company and do your presentation and they can just check off a box and keep it moving. It's not about just having the presentation or having the conversation. It's about having a plan. So your experience, do you feel that companies are taking mental health in the workplace seriously in terms of being culturally competent and really coming up with a plan to back up the conversations that they may have had with Mercer?
Yeah, so I'm very pleased to, denote that mental health is one of the highest priorities for many of our leading companies, right? Because if you think about it, companies are made up of people and individuals who are living in society, everybody. So people, the leaders are dealing with it with maybe their own children. So, or, family members. So everyone understands right now that mental health is a high priority. And it could be tied, companies, particularly for-profit organizations, we want our employees to come and do the best that they can so that we can make money. And if they don't, because of mental health and mental challenges, that can impact the bottom line. So there's a direct correlation to health and health equity, to profitability and success of an organization. And so we want to make sure that we mitigate all of those challenges so that these employees can come forth. So it is a high priority. It's a matter of what do we do. Many of them are implementing telehealth services, leveraging third-party vendors. They're doing navigation services so that you can navigate the very complex system of healthcare, particularly around mental health. And so organizations are investing in sizable investments when it comes to mental health because they recognize there's a direct correlation to productivity, belonging, and all of those metrics that make for a very robust organization. And so, we want to continue to see that. So Mercer goes in and we make sure that where there's gaps in coverage, where there's barriers, where there's lack of understanding the different populations, we educate them on that and say, let's look at some solutioning around ensuring that populations can benefit from these robust benefits. And we'll look at data. I'll tell you, we look at data and we'll see that certain populations are absolutely taking advantage of the offerings that companies are using. And then you'll see this tremendous drop, say, if you're looking at people of color, significant. So underutilization. And what I tell clients is, if you see underutilization of mental health services that you're providing, that's not a good thing. That means that we are not effectively communicating out to the populations who we know need it even more so than other populations, that this is available. And if we think we're doing a good job, then why are we not seeing the utilization? Is it because of the provider or clinician choices? Is it because of the out-of-pocket costs? Is it because of the technology may not be effective? Maybe they don't have, the data plan or the phone or the Wi-Fi. We have to dig deeper and identify the best approach. Or it could be stigma, right? Again, we still have stigma and challenges within communities. So then maybe it's a campaign, like we talked about, to say, let's look at doing some things differently. So we have to figure out where there are gaps, where there are challenges, where they're not being used by populations, and encourage and foster that and make sure we have an environment for that. And that's what we work with clients on.
And when you talk about data and you talk about how mental health challenges are negatively impacting productivity, do you find that at times you have to make a business case for companies to invest in mental health resources?
Oh, we have to make a business case to invest in any resource in companies. If there's not a business case, they're not going to make the investment. They want to see an ROI and what that means. And some of these are soft metrics, so it's harder to to do a complete ROI in that investment. But we do understand, and they do understand that it is going to impact productivity. Yes.
To wrap up, what are some things that employees can do to safeguard their own mental health in the workplace? Say you're somewhere where maybe they don't have EAP, because not every company has it, or they don't have a mental health plan that they're encouraging employees to take advantage of. What are some things that one can do on their own to safeguard their mental health at work?
Yeah. So first of all, if they don't have it, they need to talk about it, right? So they need to go to their HR and they need to have the conversation on what resources do you have available to support us. I would say majority of major companies may have some type of resource or information to help around mental health. But if they don't, they need to do that, right? And they have to advocate for themselves. Because aside from that, you're going to have to try to navigate the complexity of the system on your own. And if you have an organization or a company to work with you to navigate the system, then that's going to help you further along. But I would suspect that many of us don't even capitalize on what's available. So that's where we need to start, is to go into our organization and identify, it may not be easy to go, looking at your benefit guides or going to the website and see what resources are available to support you. And you might be surprised to see that there are countless, they may have videos, they may have different tools to help you with mental health. So I would recommend your listeners start there. And if they don't have it,
It's like, what if, part-time somewhere, but even your part-time, your 30, 20 hours is draining. What are some things that people could do?
first and foremost, you have to consider seeking help. So whether it's looking on your own and leveraging your insurance, if your company doesn't have anything and you do have some form of insurance coverage, absolutely contact your carrier and see what resources that they have to support. But I would recommend finding the resources that are available, because they're there if you have insurance coverage. And it's going to take a little work, but it's going to be worth it, right? It'll
And
be worth it.
there are some free, there are therapists that are free or fee scaled.
Yeah.
There are some organizations that help with assistance with payments. And there
Mhm.
are other organizations where the people aren't necessarily licensed counselors, but they are people there to talk to. And sometimes something is better than absolutely nothing. I think getting together with friends and peers, or if you have a mentor, talking about those types of things can be really helpful. Because one thing with depression and anxiety is it can often be very isolating.
Yes.
Tendency is to recoil and withdraw, which oftentimes can just exacerbate those feelings. So even though it's really, really hard to reach out when you're depressed, it's really, really hard. I struggle with anxiety and depression, and it's
Yeah.
very but I have to push myself to reach out. And fortunately, I have built a community of people. They're not necessarily all here in person, but a community of people that I can reach out to from time to time and touch base, and at the very least feel supported. Because oftentimes when you're depressed and have anxiety, you feel so alone. Even the person that's sitting right next to you could be going through the same exact thing.
Mhm. Yeah.
Taking a cue from this, these fresh millennials who are coming out and being more vocal about mental health, I think that's really, really important.
Absolutely. Absolutely. I mean, we always talk about having a village. And, there are many community-based organizations that can support for those who don't necessarily have insurance coverage or aren't working for employers, so you're self-employed. There are community-based organizations to consider when it comes to mental health. I would implore our listeners to consider those. Um, and just do a little research, but lean in on it, and don't be afraid to have those conversations. We're coming out of a major, pandemic, so we know there are challenges. And again, our surveys are showing there are challenges across the board with everyone many with post pandemic. And so we want to leverage um, the resources available to address mental health for ourselves and for our families and our community. Right? It builds us up, and it uplifts us if we can overcome those challenges. And I'm
Absolutely.
excited. I'm excited that we're here, because 10 years ago, we probably would not be having this conversation. And
Yeah,
fast forward now, we're very comfortable talking about mental health within our community, the Black community, but in general, and imploring people and asking people to seek help when they need help.
because Black mental health matters.
Absolutely. Absolutely.
So Vicki, it has been an absolute pleasure
It
speaking.
has.
Thank you so much because I didn't think I even was aware that these types of programs and companies exist that really, go out and help these companies be more effective with their mental health resources. So thank you for what you do. Thank you for joining Carbon Convos. And I just really appreciate your time.
Yes, yes, absolutely. And look forward to staying connected.
Absolutely.